Hello everyone, Nurse Nilla here. If you are considering becoming a healthcare worker, you should determine if you have a heart of a healthcare worker. Let's take a look at the qualities that you will definitely need in the healthcare profession. 1. Compassionate. You must possess a compassionate heart. A heart that seeks for the good of others, that goes above and beyond, seeing the best of their patients despite their presentation, in spite of their vulnerable physical presentations or their functional weakness. You are moved, compelled beyond reason. So be an advocate for that patient, to see that patient succeed and triumph over that illness, going above and beyond. A compassionate heart is a necessity, because being in healthcare must come from the heart. 2. Empathy. Most definitely, you have to be empathetic. Empathy means that you are emotionally able to feel what your patients are experiencing without you experiencing it physically. It's like being in that person's shoes. For instance, if your patient have pain, how would you feel if you are the one in pain? So empathy compels you to move and do the right thing by your patients. Thirdly, attention to details. You have to be attentive to the minute changes, insidious changes that are happening with your patients. You first of all have to know who they are as a person, because you need to know who that person is in order for you to identify the changes when it happens. So paying attention to details matters a great deal, and that could very well save a life. 4th, effective communication. Yes, in healthcare, you are working with human beings. You are working with patients who are at their very weakest moments. They might not be able to communicate to you. They might not be able to speak to you. But you have to understand both verbal and non-verbal means of communication. When that patient is not able to open their mouths, but they are exhibiting other physical symptoms that is sending you very loud signals of what is going on with that patient, you must be able to pick on it. So communication comes in 2 ways: verbal and non-verbal. And evidence supports that non-verbal communication is one of the most common ways that we all communicate. So ability to communicate effectively, verbally and non-verbal, will effectively enhance and foster patient-nurse relationship, patient-physician relationship, patient-healthcare worker relationship. So these 4 characteristics that I shared with you are not in any way all that you need, but they are definitely key essentials based on my years of experience in healthcare.